Hello guys, welcome to my channel. So today we'll be talking about asthma drugs and the MCQ mnemonics to remember it in easier way. So before you proceed this video, please do watch the part 1 of this video in which I have given the classification of the asthma drugs and the mnemonics for it. It is given in the link description below. So let's proceed. So the questions are taken from Dental Pulse. Beta-2 adrenergic receptor stimulating drugs are used in we have bronchial asthma, cardiac asthma, and the hypertension and the angina pectoris. So first of all, you need to know what is beta-1 and beta-2 in order to understand the question. So beta-1 they acts on the heart and beta-2 receptor acts on the lungs, which will cause dilatation. It is very easy to remember. We have one heart, therefore beta 1 acts on heart, and we have two lungs, therefore beta 2 receptors acts on the lungs, and it will cause dilatation of the lungs. So in the question you can see that all the other three options are related to the heart: cardiac asthma, hypertension, and angina pectoris, except bronchial asthma is related to lungs. Therefore beta 2 adrenergic receptors will act on the lungs, and you can also see, so answer will be bronchial asthma. And you can also see that they have asked beta 2 adrenergic receptor and not beta 2 blocker, so it will be adrenergic, which is Fabry. Long-acting beta-2 agonists are, so we all know what are beta-2 agonists from our classification, but which one is long-acting and which one is short-acting? Let me tell you the mnemonics. So we have salmeterol and we have salbutamol. How are you going to remember this? In salbutamol you have BUT, but which sounds like boots. If you wear boots and run, you will cover a shorter distance, and if you run without boots, you will cover a longer distance. So remember, salbutamol, they will be short acting drugs, as you will cover shorter distance while wearing boots. So in the same way, tert-butaline, which consists of BUT but boots, so they will also be shorter acting drugs. Wherever there is BUT in the drug, they will be short acting drugs. They will cover shorter distance. So for salmeterol, whenever I see me, I used to remember Milka. Milka Bag movie. If you're an Indian, you will know. Whenever he used to wear boots, he would run very slow. And when he never wore boots, he would run faster, longer. So here there is no but. In salmeterol, there is no BUT. Therefore, long-acting drugs, that means without boots, he would cover longer distance. So in this way, remember salmeterol as long-acting drugs. So coming back to the questions, in A and C there is but which sounds like boots. Wearing boots, we will cover shorter distance. So the answer is salmeterol. So there is no but in it, so long-acting. Before we proceed to our next question, I hope my mnemonics won't mislead you. So you need to know that the long-acting drugs will act slow on body because they are long-acting drugs. They will take longer time to act on body. So long-acting drugs will act slow on body, and short-acting drugs will act fast on body. Don't get confused between short, fast, slow, long. Remember that I have talked about the distance covered with boots as the short drugs, short distance, LD, long distance, long drugs. So now coming to the questions, one of your patients is found to be dysphonia. Auscultation of the lungs revealed bilateral diffuse wheeze. Which drug would you like to use for fastest relief? So first you need to understand the question that the patient is found to be dysphonia, which means dysphonia means the patient is breathless, difficulty in breathing, and it is a serious life-threatening situation. So which drug will you give? You need to give a drug which will be very fast and पटक से पेशेंट को हमें relief करना है. So you can't give salmeterol because salmeterol is a long acting drug, so it will act very slowly, like I've told you previously in my previous slide. So obviously we need to give salbutamol, which is a short drug and which will act very fast. Now you can see option C, Montelukast can't be the answer because they are prophylactic drug. Prophylactic drug means preventive drugs. Before the serious situation has occurred, we administer that drugs. So we can't give Montelukast because the serious situation has already occurred. Patient is already breathless. So this is a serious situation where we need to give a fast acting drugs, that is short acting drugs. Now, ipratropium bromide is also a short-acting drugs, but they have less efficacy than salbutamol, which is a symptomatic. So, and ipratropium bromide acts more on COPD. So, answer will be D, salbutamol. So in the next question, which of the following symptomatic is the most bronchodilator? So I have given above like the symptomatic drugs where it has been written alpha and beta effects, predominantly beta 2 effects. Among all these, which one is the most bronchodilator? I have told you in my previous classification also, whenever I see this beta drugs under symptomatic agent, I am like beta India top girl. Since you are preparing for your examination, इंडिया टॉप कर. So be the first one. बाकी सब बाहर में जाए. So isoprenaline India and adrenaline noradrenaline. So isoprenaline will come first. And I also seems like number one. Be in number one. Top one में better. So isoprenaline will be the most symptomatic agent, which is the most bronchodilator activity, having the most bronchodilator activity. All of the following drugs may be useful in acute exacerbation of bronchial asthma except. So you need to understand the question. Acute exacerbation matlab to become serious, to become exaggerated. The bronchial asthma has extended and in the end it has become serious. It has been acute. पटक से seriousness हो गया. So which of the following drugs? All of the following drugs are used except कौन सा को हम use नहीं करेंगे. So cromolyn sodium, it is a mast cell stabilizer. They will be anti-allergic. So we really need this in case of acute exacerbation, in case of acute serious condition. And salbutamol, as we have already discussed, it is a short acting drug, so it will act very fast and पटापट से ये काम करेंगे. And hydrocortisone also, like I've told you, like systemic corticosteroids, it is a systemic corticosteroids which we use when nothing works. Like we know that we have systemic corticosteroids and inhaled corticosteroids, which is very common. So A, B and C, we will use this during acute exacerbation, and we are left with D, ipratropium bromide, and they are not used in case of acute exacerbation, but rather they are used in regular attack of asthma. Bronchospasm can be precipitated by. So bronchospasm means there is constriction of the bronchus, and precipitated means it will increase. What among the following drugs, which drugs will cause the increase of bronchospasm? So obviously in asthma drugs, they cause relaxation of the bronchus. So adrenaline, atropine and salbutamol from the classification are a treatment for the asthmatic drugs. So the answer is propanolol, which is a beta blocker. So they will cause bronchospasm rather than a relaxation. Thank you so much guys for watching my video, and it means a lot. And please do comment below and give your reviews, what changes I have to make in my teaching. And for the mnemonics Bug Milka Bug, please do watch this movie. It is really inspiring and it is a true story. So if you are bored and if you have some time, you may watch this movie. Thank you. And wait, please do like, share and also subscribe to my channel.